Thank you for staying with the daytime update. While Deputy President David Mabuza has raised concerns about the country's vaccine rollout, an expert has warned that the country may experience a third wave much sooner than anticipated. Professor Alex van der Heever, a health and social security specialist at Wits University, cautions that a combination of factors may push up the country's active cases earlier than expected peak of June or May. He now joins us via Zoom. Professor, very good afternoon. Thank you for speaking to us. Should we be scared about this possible third wave?
I think we should be concerned about two things. One is the second wave, and secondly, the fact that looking at the excess death information is a good indicator of the trajectory of the epidemic, that we're not actually seeing many provinces drop to very low levels of excess deaths, suggesting that the sort of prevalent levels of community-based infections are relatively high, even during this period down phase. But we are also seeing upticks in various provinces as well, and that's now happening before we go into the Easter weekend. So we are perpetually at risk of super spreading events seeding and catalyzing basically a third wave.
Now, relaxed regulations have obviously in some instances been the cause of this upsurge. What can government do?
So I think we have to look at a mix of measures that we can keep perpetually in place that do not unduly undermine the economy. The gatherings that are not necessary should really be restricted. In other settings, protocols have to be carefully considered. So in the case of shebeens, pubs, etc., where people are indoors without masks, are very, very high-risk settings. Taxis are very high-risk settings. It's very clear that they are not being, that the restrictions required for taxis, such as open windows, are not being enforced. Those kinds of things will lead to an upsurge and are probably perpetuating a relatively high level of continuous transmission in society.
So do we have an actual idea of those that are catching the virus at this point, how they're getting it?
No, there's not enough detailed information being provided. What is very clear, though, is that there are a number of different data sets that can be looked at to sort of assess the extent or the severity of the disease at any point. And the actual reported infections potentially understate what is going on at any period. The very useful information from the South African Medical Research Council, which provides the excess death estimates, provide probably one of the best indicators, hard indicators, of the extent of the disease with a lag of about a week. And what that is showing is that we are not dropping to low levels. A lot of people are potentially dying that are not being reported as COVID deaths in the official reports. So we are perpetually facing a relatively high risk of infection at all points in time in South Africa.
So the one thing that we're certainly aware of is that super spreaders, obviously as the name defines, are potential causes of COVID-19. But I think there have been many reports also about alcohol, the intake, and obviously subsequent activity around that. What are your thoughts, Professor?
I think we have to make a distinction between the setting which causes super spreading events and the consumption of alcohol. If you're during the last wave, restaurants were left open. Alcohol was prohibited, but the restaurant setting, if you were drinking alcohol at that restaurant, you wouldn't have had any increased risk of transmission. What tends to happen is that certain contexts where alcohol is consumed can be high risk, such as a pub or a shebeen, where that is the only purpose for going to it, or a nightclub. And in those areas, it's the actual setting itself that is high risk rather than the alcohol. So the question really is whether you regulate the settings properly. The alcohol doesn't really come into the picture. The other factor that has impacted on the restriction that has impacted on the epidemic that we've seen in the past appears to be the curfew. And the curfews do have, basically they attack all gatherings. And as such, they can have an impact on super spreading. So just to note what I think has been revealed in this pandemic is what's called the so-called dispersion factor in the epidemic, and that's a small number of people are typically responsible for infecting most people who get infected. So around about 10% of people infect 80% of people, and 80% of people don't infect anybody or only one other person. So what we're seeing is that we've got to control the environments which drive the 10% of people infecting the majority. And those are the contexts for super spreading. Alcohol is not in and of itself a super spreader. It's the contexts, certain contexts, which are high risk, where the coincidence of alcohol and the context itself are a problem. And you can directly regulate those contexts. Pubs, shebbeens, nightclubs, parties, funerals, major religious events where large numbers of people collect.
Prof, can you practically regulate those? Because obviously if people are having house parties or having other parties that are not happening in public places and are imbibing, what are the chances that there will be some adherence? There's obviously no need for adherence if there's no alcohol being served. And obviously, and again, second part of the question is, if the third wave is a possibility, as it appears to, and the impact will be massive on the economy, is it something that government should seriously think about?
Well, it would. So, for instance, that by the curfew has probably been quite effective in dealing with super spreading, because essentially you can't remain at that party beyond a certain period of time, otherwise you're going to have to sleep there. And so it has an effect of at least limiting the time period over which certain kinds of events, super spreading events, are going to occur. So I think that is one measure that one can look at. The other is that regulating those environments require that there are very clear rules to gatherings that make it easier to enforce. And I'm not sure that we've necessarily done that. I mean, during the last surge, the closure of beaches and arresting divers walking to go into the beach is not really going to curtail much transmission. But taxis with windows closed are going to be a super spreader. So I think that we've got to get the proportionality right. I think it's absolutely crucial that the interventions that are done minimize the impact on the economy, but maximize the impact on high-risk behavior. I think it's tricky, and not enough research has been done by government into which measures had the biggest impact on super-spreading events. We have these kind of aggregate combinations of interventions which have an aggregate effect. And we
Prof,
don't know
I'd like to, sorry, just to come in there, I'd like to talk a little bit about taxis and your assertion that there are super spreaders. I mean, there are millions of individuals that travel by taxi every single day. What are the stats of those that have caught the virus from having been on a taxi, if you have those? Because I'd like to think that if there were super spreaders, then the stats would obviously be a lot higher than they are currently.
It's almost impossible to attribute community-based transmission to specific contexts, because you're getting the reported infections days after people have been infected, and they could have been exposed in multiple environments. So really all one has is a sort of a general assessment of a risky situation. Now the taxi itself is not necessarily high risk if the windows are open, because you've got proper ventilation. So that actually is what you look at. If you're going to be in a taxi for longer than 15 minutes, or any enclosed space for longer than 15 minutes, even wearing a mask, your risk of being infected by somebody who's positive in that taxi is very high. So what you want to, the contribution of taxis to the overall pandemic can't be attributed properly, because we're not measuring all the environments properly. But what is clear is that a sort of overall diminished activity, the closure of any space where people are at risk in poorly ventilated spaces, does appear to have a significant effect on transmission. What was very interesting in the last surge, the last sort of wave, was when government introduced the sort of combination of interventions on the 27th of December. there's if you look at the statistics, about sort of 11 to the 13th of January, you have a very steep downward trend that occurs pretty much on the same period in every single province. That's one of the clearest indicators that we've got that one of those measures, or a combination of the measures of 27th of December, were very effective. And I think that's where we've got to look. But the problem is that I think that we don't have enough detailed and granular information in the public for researchers to examine. And it's not clear that government itself is researching the information it has but is not revealing to the public effectively. But that would be, in moving forward, because we got such a delay in getting access to vaccines, that kind of analysis makes a lot of sense, because you want to have the combination of interventions that do not unduly restrict the economy. We actually can't afford to undermine the economy further in South Africa, because it has so many knock-on effects, including fiscal effects. So we have to get the combination right, and we have to get the efficient combination right. I don't think we're there yet, and therefore we have a risk that we will go back to more kind of sort of generalized interventions in the hope that one of them actually has an impact.
Well, we'd all hope that the vaccine rollout would mitigate catching COVID-19, but clearly it's not happening quickly enough.
Not at all. I think, what I find scandalous is that in the sort of media briefings that Aspen Pharmacare has given to its investors, has indicated that they will successfully do the final bottling and export of 100 million doses of Johnson & Johnson from Port Elizabeth, and that in June of this year. So South Africa is going to have 100 million doses of Johnson & Johnson in the South African territory, and not one of those is going to go to South Africa. And I find that unbelievable, that the South African government did not get involved in contracting for 40 million of those doses, because 100 million is going to the United States. The next 200 million is going to Europe. And then the next 100 million for 2022 is going to go to so-called developing countries.
Professor, those are certainly questions that we'd like to ask and certainly chat about, but unfortunately we've run short of time. This is the Daytime Update. I'm Hugo de Batika. Do stay with us. We'll be right back after this.